And we have had quarterly performance dialogue with states. We have had multiple engagement with state governments, with commissioners of health, with our development partners, through various working groups, which have looked at the data. And we have used instruments such as the People's Perceptions Survey. Last year when we set the agenda, we had a People's Voices survey that was conducted, interviewing almost 2,500 Nigerians to get their perception. Because if you recall, the first pillar of the agenda is to improve governance and to orient Nigeria's health system to respond to the needs of Nigerians, which is the President's renewed Hope Agenda, the Health Sector Renewal Investment Initiative. And this year we have a perception survey which is conducted in, across the 36 states, interviewing more than 2,600 Nigerians as a sample to get a sense of their perception on our way to continually assess how do Nigerians feel about the health system and the impact of what we are trying to do. And that will be reviewed next week at the Joint Annual Review. We also have data, because it's important to track objectively. We have now gotten the result of 2023 DHS, which is like a baseline, which has now been organized systematically across different states by different indicators to tell what has been the trend, so that in 2 years' time we can reliably come and say, okay, this improvement that we're talking about, here's how much we've achieved, here's how much we may not achieve, here's what we have learned. Because it's important that we have those matrices that we can track our progress. That is also something that will be discussed next week during the Joint Annual Review. And that was a collaborative effort across different stakeholders, Ministry of Health, the SWAP office, our key agencies, our partners, looking at the data so that when we talk about numbers, we know the numbers that we are talking about. There are other blocks of work that have been going on over the last 12 months in reproductive, maternal, newborn, and child health. Understanding where are women dying, what are we doing about it, how are we changing the interventions. The retraining of frontline health workers, how is it going? On HIV, TB, and malaria, where are we? On preventing mother-to-child transmission, where are we? On commodities, how is the situation of stock of commodities? How do we crush maternal mortality, given where mothers are dying? Because we realize that mothers have risk of dying in Nigeria, not equally in all parts of the country. There are particular local governments, about 172 of them, which account for more than half maternal mortality. So how do we target them now that we have identified them? So let's review it collectively with the best intervention that we can deploy. How are we doing on the infrastructural upgrades that we said? How are we doing on the health security pillar of our agenda? Now with the resource that we've raised, we need to look at where do we go from here in terms of the annual operational plan that have been developed by the states. Those are the kinds of things that the joint review will interrogate by government, us, our teams that have been working very hard, our development partners, our partners at the state government, local governments. Of course, the citizens' voices are included, and the culmination of that will be the first state of health report, which will be the first time there will be a state of health of Nigeria report. And on an annual basis, that will now be like a report back to Nigerians, because all of this is to serve Nigerians and to report back to His Excellency Mr. President, to the members of the National Assembly, and we would come out of the Joint Annual Review to go to the National Council on Health, which is the apex health policy making body in our fiscal federalism, and then to make this public. So this particular moment with members of the press is to give you a heads up, because we have embarked on a partnership also with you. In the course of last year, you have had engagement with the MOC Secretariat to understand doing so that you can be able to explicate to Nigerians. For instance, if you look at the state-by-state scorecard, each state, there is a ranking, which is blue, red, yellow, in terms of the data that we have. You can also see, this is based on DHS, and by zone, how are the states doing by zone? We have communicated this to all the 36 state governors already, so that there are no surprises. And it's not necessarily good or bad. First, you need to know where you are. And as we push hard, then we see where we're making progress and where we're not making progress. So those are the kinds of things that will guide our discussion. And then for the perception of Nigerians, the perception survey, for instance, shows, in fact, some very interesting results over the last 12 months. That, in fact, their rating for public and private systems, for last healthcare visit by facility, for different levels of care. An important one, for instance, is that primary care, the sense is that it's good. Tertiary care is good, but there is room for improvement in the secondary health care. So that's what citizens are saying. And we have to factor those in, that we need to do more on quality of care, and that the private sector is perceived to also have quality, but the public system also has quality, and all sectors have still issues to deal with in quality of care. That is important feedback to know from Nigerian citizens how. So this is the value of this. So it's not to judge anyone. It's not passing judgment on us or on any state or any local government or any development partner, but it's just interactive co-creation of the revampment of Nigerian health sector. We're very pleased to know that, in fact, the perception is increasingly positive, but we have to sustain it. So I want to stop here and say thank you very much, members of the media, for covering us. But the meat of the matter will be next week, when the joint annual review is conducted. And then you'll have many actors that you can interact with. You can ask them their views. We have external folks who are coming, who are supporting Nigeria development partners. We have state governments, state commissioners, and everybody. Let's have a conversation on health. So next week is the conversation. So I'll stop there. Thank you very much.